Welcome to the state of Indiana. Population 6,423,113. Race cars zoom past groves of stunning foliage, and starry nights greet the sunset over unique and beautiful sand dunes. But behind the delightful quaintness and pleasant atmosphere of our wonderful state lies a harsh and alarmingly dark reality. 735,000 Hoosiers, or over 11% of the state's population, live without any health insurance coverage. Since the year 2000, this number has increased significantly and continues to rise even beyond the national average. Indiana residents are losing their jobs, losing their livelihoods, and perhaps most horrifically, losing their ability to pay for and receive vital medical care for themselves and their families. Compared to the average U.S. citizen and citizens of other states, Hoosiers are unhealthy. Indiana has the 37th lowest life expectancy in the United States, 76.9 years, as compared to the national average of 78 years. 30% of children and 63.5% of adults are overweight or obese. 31.7% of Hoosiers did not once visit a dentist in 2008. Indiana residents are not receiving enough preventative care. They are not receiving even the most basic treatments. Why? Because they cannot afford it. In 2007, an estimated 18.8% of Indiana residents had annual incomes at or below the poverty level, an increase from 10.5% in 2002. Of Indiana's approximately 400,000 single-parent families, 47.3% were living at or below poverty level in 2007, an increase from 19.8% in 2002. These disheartening statistics reveal the plight of the Hoosier family is increasing and will only continue to do so. The state of Indiana has seen these trends and made a gallant effort to alleviate the economic pressure that healthcare places on already struggling families of all types. The Healthy Indiana Plan, enacted in 2007, has provided an affordable alternative to standard private health insurance for its participants. The Healthy Indiana Plan, or HIP as it is commonly abbreviated, accepts applicants between the ages of 19 and 64 who have incomes between 22 and 200% of the poverty level and are not eligible for Medicaid. Those covered by HIP make a monthly contribution to the program amounting to no more than 5% of their gross income. This payment goes toward a personal wellness and responsibility, or POWER account, the rest of which is filled by state subsidies. This $1,100 can be used for any eligible services, excluding preventative medicine, for which the state provides an additional $500. HIP promises to pay for up to $1 million in lifetime services for each participant, but does not cover vision, dental, or prenatal care. Two private insurers, Anthem Blue Cross and Blue Shield, and MD Wise with AmeriChoice, provide coverage for those on HIP, with the exemption of those with serious and chronic illnesses who are covered by the Enhanced Services Plan. Currently, all of the approximately 130,000 spots in the program are filled, and the waiting list consists of thousands. Additionally, the plan only allocates 34,000 spots for those without dependents, and the waiting list continues to grow exponentially as more and more Hoosiers are losing their employer-based health coverage. Hoosier HealthWise, the Indiana equivalent of Medicaid, covers pregnant women, children, and low-income families who make less than those eligible for the HIP plan. The goals of the program, as listed on the state website, are to ensure access to primary and preventative care services, improve access to all necessary health care services, encourage quality, continuity, and appropriateness of medical care, and provide medical coverage in a cost-effective manner. But Medicaid, just like HIP, is crowded and budget-straining. In 2006, over 1 million Indiana residents were receiving benefits from the program, and in 2008, the state spent a total of $5.25 billion on Medicaid. This already incredible spending is discouraging for the millions of Indiana residents still struggling and in need of state assistance. Even more disheartening is the alternatives they have in the private insurance sector. In Anderson, Indiana, WellPoint and United Health Group Incorporated control 89% of the market. In Gary, Indiana, a mere 16 miles from Valparaiso, and in its metropolitan area, Healthcare Service Corp and WellPoint control 92% of the market. These types of monopolies are common throughout the state, as Indiana ranks 14th in the least competitive states for the health insurance market. Lack of competition drives premiums up and benefits down, forcing Hoosiers to enroll in expensive plans that do not meet their needs. The insurance monopolies are not, however, the only threat to consumers in the state. Misleading and useless policies, or junk insurance, has become a large threat to Hoosiers. Plans marketed as having limited benefits and affordable premiums are often more trouble than they are worth. Agencies underhandedly trick beneficiaries, offering plans that have ceilings on spending for certain types of care, such as cancer treatments, or even stipulations that prevent testing performed on the first day of a hospital stay from being covered. How can we prevent the Indiana consumer from being exploited? How can we ensure that every man, woman, and child in the state of Indiana receives the medical care that they need and deserve? The answer is a public option. A public option provides consumers with an alternative to private insurance that they themselves purchase or receive from their employers. Public options provide viable competition for private insurance companies, transforming monopolies into true market systems. In a public option scenario, purchasers are given more choice in policy and benefits, and insurers are forced to offer more competitive pricing, increasing affordability. Now, our opponents will attempt to tell you that a public option implies socialized medicine or universal health care, but these terms are not synonymous with a public option, nor are they related. A public option is simply the introduction of a new company to the market. The policy would be offered to anyone who wishes to purchase it, eliminating the pressures of discriminatory practices endorsed by private insurers and perhaps discouraging them completely. The road to a healthier Indiana is impassable for too many Hoosiers who can't afford to pay the toll. The idealistic Healthy Indiana plan is just too small to accommodate struggling Indiana residents, and the flawed and expensive Hoosier Health-Wise limits the impoverished and bankrupts the budgets. Insurance agencies are taking advantage of desperate consumers in need of coverage, pushing the limits of ethical business practices. The unhealthy Hoosier state is in need of reform. This is why Indiana should institute a public option health care plan.
The government health care programs in place that you mentioned, such as HIP and Medicaid, are strapped for money and are inadequate. How will you ensure that the state option does not follow the same path?
Thank you very much for your question. Should Indiana institute a public option health care plan, programs like HIP would be null and void, and programs like Medicaid could afford to be cut to allow money to be spent on this public option plan. So money wouldn't be as large of an option because it would just be moved from one thing to another. Indiana has actually shown a budget surplus in 06, 07, and 08. Plus, people will be paying for the plan, so that also brings money